Boy, NACCHO is so important to local public health. Off the top of my head, there are at least, I think, four things that really rise to the top for me. First of all, is they are a national voice and advocate at the federal level to assure that the policies that the federal government puts in place around public health are grounded in the local reality and diversity of our communities, so that those policies can sort of work across the country for folks. And advocate, obviously, for funding so that the work of local public health can get done. So that's incredibly important, I think. The second is this opportunity to learn from each other around what are others doing in other parts of the country that might be applicable to where we are, especially if you look for communities that are similar to yours. What programs, what services are being developed, what policies are being put in place, and how did people get those done? So those sort of best and promising practices, I think, are incredibly important. A third thing is that gathering of intelligence when we do have disease outbreaks or other sort of public health threats that are occurring, that we can rapidly share information, learn quickly from others, so that we can start preparing in our own area if we haven't seen something yet. And the final one, I think, for me, is the ability to develop the leadership, both within our health directors and our senior teams and other managers in our organizations. So that ability to develop ourselves so that we can increase our skill sets and really be the most effective leaders we can. NACCHO really helps with that. So those would be, I think, the four things to me that rise to the top. So I guess what I hope for NACCHO is really more about the system and how do we truly get to a governmental public health system in this country that's actually a system. Right now, we have many different locals, we have state, we have federal, who are not necessarily working together as truly a system, either because of laws or other things that get in the way of sharing data, of really acting together. And that's holding us back, I think. I don't have the exact answers for some of this. Certainly the data modernization piece is a part of that, but it gets to some of the root pieces that I think we need to solve. How do we operate in a federated system, but also operate as one? And I think that's our challenge, because I think we found with COVID that was a challenge, and most things we do we're not being as effective as we could be. So I look forward to the leaders of today and tomorrow really taking that issue on. So I was very involved in NACCHO in sort of 2006 to right before I became Secretary of Health in 2012. I was actually the president of NACCHO right at that time. I had to cut my term short by a few months, taking on that other role. So this was in part, some of this was during H1N1. So some of the same systems or issues that we found in COVID were certainly present. How do we have enough capacity to do the epidemiology work? How do we respond as responders, whether that was in vaccination clinics, prioritizing resources. So some of those were very similar that we were encountering. And I think, again, the piece of how do we maintain our capabilities and capacities beyond these infusions of, these emergency funds that come were clearly some of the policy and system issues that we were addressing. I think also there is this piece of how do we do our best to implement the foundational public health services and capacities, especially on the side of the pieces around policy and systems change, and owning that leadership in some of that space in our communities, in doing that cross-systems work. So there was this piece of really recognizing that that's the work we need to do, and helping people move into that space, both in terms of leadership and skill assessment. We certainly find some of that, I think, is still true today, and it's certainly true in the sense that with COVID and the burnout that's occurred with that and turnover in workforce, we've got to keep developing the skills of our staff in that space. I am public health, providing leadership across governmental public health and academia. Please join me.